All right.
If I give you a couple of links, would you mind to share them in the chat for me?
Not at all.
When we get to them in the conversation.
Absolutely. Yes, you
Um,
should be able to put it into private chat with me, and then I can just have them geared up to be able to do that.
let's see here.
Is
I only see private chat, but I don't see for you. Let me see if there's a way that I can click on you. No? Okay.
Let me
Well,
see if you let me try the private chat and see if you get
it's
it. Oh yeah, I see it.
yeah,
Okay,
it's only
awesome.
going to you. Okay,
Yeah,
okay, okay. So
exactly. Yeah.
this is going to be closer to like the end of the presentation. And there'll be a slide that comes up for Moms Rising where there'll be a place for them to story share. I
Okay.
thought that if you wouldn't mind to pop that one, and then I have one more
Okay.
um, that is this one's going to be closer to the beginning, like in the first couple of
Okay.
slides. This
Okay.
is a link to our Policy Action Center, and
Okay.
for the first 5 people who sign up for our policy alerts, I am going to give them a free membership to our Action Network. And this is
Oh,
where they'll need to
wonderful.
go to sign up to get those emails. So,
Thank you so much for doing that. I appreciate it.
no problem. Hopefully we'll have at least 5 people, so that way they'll want to.
Absolutely. Absolutely. So I'm going to actually also, it's interesting because as a moderator, we don't see as much of the participant stuff as we do as as an actual attendee. So I'm going to go ahead and just join as an attendee on another browser as well. And Joe Allen Malia says, good morning. He's heard a lot about you. Yep. I think you were muted. There we go. Okay.
Oh no, I'm sorry. I was muted. I was laughing. I said, hopefully it's good things. It would be bad if it was bad things. But good morning or good afternoon, I guess it is.
All right, so I think we can go ahead and get started. So we are so excited to have Malia Rose Waters with us. She is the policy director at Prevent Child Abuse North Carolina. And so I am going to let her take it away.
Yes. Hello, everyone. Thank you so much for spending your Saturday afternoon with me. I'm really grateful to be here with you, coming into your homes and your living rooms on this Saturday afternoon via an online platform. So I'm going to go ahead and screen share, and hopefully you'll be able to see my presentation here in just a second. All right. So, what we're going to be talking about today is prioritizing upstream prevention policies. Uh, I work at Prevent Child Abuse North Carolina. We are focused on primary prevention. So, that's making sure that kids and families have the support that they need so no abuse or neglect happens. And we're going to talk a little bit today about what those policies are that will prevent child abuse. We have some pretty strong research around preventing child abuse and actual policies. So, Couple things that we're going to talk about today. I wanted to give you all some learning objectives so you'll know what to kind of look for in this presentation. So we're going to go over the 5 protective factors that prevent child abuse and neglect. These are 5 protective factors that are based in research. They're most certainly not the only things that can prevent child abuse and neglect, but they're the ones that seem to be the most common when it came to the research as far as like what families needed. Policies that promote safe, stable, and nurturing childhoods. We're going to describe the evidence that supports policies. So I'm going to share with you a little bit of the research. And then I'm going to give you, number 4, some concrete next steps to promote these policies locally, statewide, and nationally. First, I wanted to share with you all, we have a prevention action network at Prevent Child Abuse North Carolina. We have around 500 members across the state that are part of this prevention action network, and we have members in all 100 counties. As part of this PAN is what we call it, you get a free monthly newsletter with a lot of breaking news and information. We also do webinars periodically. The one that's coming up pretty soon is with Claire Anderson, who is from Chapin Hall, one of the big research institutions. We're excited to have her. And what I have to offer for you all today, as being here as part of my presentation, is that the first 5 people who sign up for PCANC's policy action alerts, and that's free to sign up for the policy action alerts, okay? You will receive a free membership to the Prevention Action Network. So, and you saw on the previous slide, lots of member resources that are available only for members. It's a $49 membership, and we're going to give you ones for free, but I only have 5 available. So what you'll need to do is go to www.preventchildabusenc.org, Our Work, and Policy, and then Policy Action Network. And also there might be a link that's popping up in the chat. So what I want you to do is sign up for that. And then what you'll need to do is forward your email, you'll receive a confirmation email to me. So that way I'll know that you've signed up. And there's my email address. It's mrosewaters@preventchildabusenc.org. And I will notify the winners via email probably early next week. The first 5, though, there's my email address. I'm going to give it to you again at the end of the presentation. I encourage you just to, hop in there and grab one of those free memberships. We also, you all might be aware that April is Child Abuse Prevention Month. We do a lot of activities typically in the month of April. They've been virtual for the past couple of years, but you also receive discounts in our store to buy like pinwheels and all of that type of thing if you plant pinwheels during the month of April. So free membership if you sign up to get my policy emails. And I don't send that many. So I will say that I don't fill your inbox with alerts. All right. So moving upstream in a downstream world. And what we mean by that is a lot of times what we're talking about is intervention. We're talking about CPS involvement. We're talking about, the big stories that you may see on the news. And that a lot of times when we think about prevention, when I ask people, that's where their mind goes. They go to DSS and they go to CPS instead of thinking about what it means to move upstream. So I have this graphic here for you. What is primary prevention? Is stopping child abuse or neglect before it happens. So if you look up at the top, little bit above the middle of the page, you see the bridge there over the water. That is where the upstream primary prevention happens. Then if you move a little bit further downstream, you see secondary prevention. So that's targeted responses to at-risk populations. Some examples: early Head Start, home visiting programs that are for targeted populations, not universal home visiting programs. And then tertiary prevention. That's the long-term response to stop abuse and neglect, and minimize consequences. So we can think about that as foster care. We can think about it as trauma focused CBT that's offered here in North Carolina. So, really, we want to try, though, and get up to primary prevention. I will say these protective factors are good for everyone. They're beneficial for everyone to implement into their lives, no matter what. So, thinking about what are some key primary prevention strategies. So, we can think of that as like voluntary evidence based home visiting. So, like a healthy families or a nurse family partnership or parents as teachers or family connects, which is universal. These are all voluntary. Quality funded childcare and early education. Big key primary prevention strategy in early education and having access to quality childcare. Parent support, training, education. Family resource centers, there are several of these across the state. These are, usually embedded in communities, and they just really have all sorts of concrete supports or parenting education available for families. Evidence-based child sexual abuse prevention programs, family-friendly workplace policies, which is what we're going to be talking about today. Economic supports for families, banning corporal punishment in public institutions, and positive fatherhood engagement. These are just some examples. I wanted you all to kind of have something to visualize. Like when we're talking about primary prevention, what does that mean? These are some of the ways primary prevention happens. So the CDC releases these technical packages around different issues, and they have one for preventing child abuse and neglect. And anyone can pull this up, read through this technical package. It's it sounds technical package. It sounds like it might be complicated. It's not. It's very easy to read, and it's not too big of a book. Um, and it has in there 4 goals. One's around raising awareness and commitment to promoting those safe, stable, nurturing relationships and environments. You may have heard of our campaign called Connections Matter, where we really emphasize how important it is to have positive social connections in your life. During the past year, we've really tried to emphasize how important it is to maintain those connections, even if it's virtually, right? Like trying to still stay connected to everyone that's positive around you and can support you and your family. Using data to inform actions, like taking a look at how things are working, making sure that if we're making investments, that they're going to the places where they're going to make the biggest impact for families. Creating the context for healthy children and families through norms change and programs. So when we think about norms change, for an example of norms change, you can think about um, like corporal punishment, for example. A lot of work has been done around corporal punishment, around norms change, and what that means around early childhood development, using corporal punishment, how there are different techniques that are more effective for parenting. Creating the context for healthy children and families through policy. So we are here in North Carolina an Essentials for Childhood state. Not every state is. So we have a focus on really developing, implementing Essentials for Childhood framework here in North Carolina. So these are the 5 protective factors that I mentioned earlier. They're based in research. These are not the only ways that we prevent child abuse and neglect. But I really love this little hand model. And also, if anyone's wondering, I'm happy to share my slides with you all. I don't know if you have them yet, but if you don't have them and you would like to have a copy of my slides, I'm happy to do that. I love this hand image. It's just one way for us to kind of, visualize what these 5 protective factors are. So the first one there is your thumb. So that's social and emotional competence of children, because a thumbs up is one of the first ways that we learn to communicate our emotions. So social and emotional competence of children is really the only protective factor that has a focus on children. It's also about parents too, but there's a focus on children because we what we know from research is that when children are having behavioral challenges, that does increase the likelihood of abuse happening. You know, you think about it, frustrated, may have compounding issues happening, and if there's not any good social emotional learning happening, then that can increase the likelihood of abuse or neglect happening. You can also think of social and emotional competence like as adults, we think of them as soft skills in the workplace, like knowing how to get along with others, knowing how to be a good team player. Those types of things are also social and emotional. In elementary school, there's a really big focus on social and emotional competence. The next one, your index finger represents knowledge of parenting and child development because you're your child's first teacher. So, a parent or caregiver is the child's first teacher. That's where they're learning how to interact in the world, that's where they're receiving all their nurturing and love and caring. And it's really important that we understand parenting strategies and also child development. What is typical of a 3 year old? What is typical of a 2 year old? That's an age that can be really challenging for parents because it's hard to reason with a 2 year old or a 3 year old, right? So, what is developmentally appropriate? A lot of those behaviors completely are developmentally appropriate. I always think back to my son, who's almost 9 now, but when he was that age, when we would go to a playground, and I'm like, okay, it's time for us to go. Pack it up. Let's leave. And of course, he's like, no, I want to, no, no, no. At that age, what he could say, right? Upset, cry, and say, no, stay, right? And so I'm like, oh no, come on, let's go. I'm trying to encourage him to leave. And so what I learned was that, if I gave him a 5 or 10 minute warning, that helped the transition so much more than me just saying, okay, it's time to go. Like trying to do these transitional things around 5 or 10 minute warnings helped so much. And that's part of that is like knowledge of parenting and child development. That was developmentally appropriate for him to react in that way. And I had to figure out a strategy, right? So the middle finger, which we don't hold up just the middle finger, everyone, we hold up three together. That is your social connections, right? So your middle finger should not stand alone. You need to have good, positive social connections. And I always say positive, right? Because there are times that we as adults have to interact with people who can be challenging, right? So we need to make sure that we know how to, really set boundaries with people. So having good positive folks around us that we can count on, so important. Your ring finger is parental resilience because your first commitment must be to yourself in order to be strong for others. We talk about, you put the mask on yourself first and in the airplane, right? Before you're anyone else, you've got to be strong for yourself in order to be there for others. Another way we can think about resilience, and it's something that's a big point of conversation, especially around adverse childhood experiences. What does it mean to be resilient? And we can think of it as going through difficult times. This is the way I define resilience. You may have a different definition, and that's okay. But moving through difficult, challenging times and coming out on the other side of that stronger, right? That doesn't mean that you don't have moments where it's so incredibly hard and you're crying and you're upset and maybe you don't handle something in the best possible way that you could have handled it, right? But you move through that and you come out on the other side of it stronger. And then the last one, your pinky finger, is your concrete support in times of need. It's the smallest finger. It reminds us that we all need help sometimes. So concrete supports are going to be basic needs like housing and food and shelter. But also, we're going to talk about concrete supports in terms of policies. So, are you an advocate or a lobbyist? And included this for you all because there's often a question about, am I an advocate? Like, I'm not sure about engaging with legislators. Does that mean I'm a lobbyist? What does that mean? So I thought I would share with you all a couple of definitions. So, what is advocacy? Advocacy is to defend or promote a cause. It is active, not passive. And it's just one of the many ways to approach a problem. And I have in here in parentheses partnership because I really do feel like advocacy happens in partnership. You are absolutely welcome to go and call your legislator on your own and tell them what you need. I encourage you to do that. But also know there are probably other people out there that are experiencing the same ask or situation that you are. So I encourage you to find that group. Your voice becomes louder with more people participating. And it can be part of a community initiative. So more partnership. It's typically not a direct service. So if you're thinking about, people who are providing direct services out there, typically that's not advocacy. And it does not necessarily involve confrontation or conflict. I think a lot of times when we start thinking about policy and politics, we start thinking about divisiveness and rhetoric and all of those things that you hear these days. Advocacy does not generally include any of that. In fact, advocacy is really about educating lawmakers. So, advocacy versus lobbying, public support for or recommendation of a particular cause or policy, educating and informing lawmakers. I'm not going to read all of these to you because, again, I'll give you the slides, but I wanted to point out a couple of them to you. Making your voice heard about important issues, providing critical information for adoption or rejection of introduced legislation. Sometimes it's important for it to say, hey, we don't agree with this, right? Urging the public to contact policymakers. So that would be like me urging you to contact and to advocate. Telling your members of Congress how a federal grant your organization has received has helped constituents. And inviting a member of Congress to visit your organization if you're part of an organization so they can see firsthand how the funding of a policy or investments made in an organization benefit that organization. So lobbying is seeking to influence a politician or public official on an issue. Okay, so influence, right? When we're thinking about advocacy, that's educating. We're thinking about influencing. We're thinking about lobbying. And I make this distinction, especially if you're doing this as part of your work, because a lot of people have this question around advocacy and lobbying and what is it and what am I doing? There are rules around lobbying. Now, if you're going as an individual and as yourself, you can do whatever you want. Okay. If you want, you can lobby, you can advocate, you can do all of the things. It's when you're doing it as part of an organization that it becomes a little bit more tricky around the rules. So, key lobbying activities involve direct support or opposition to a specific piece of proposed legislation. So, if you were to call up, let's say you're working for an organization, you're like, hey, Prevent Child Abuse opposes Bill ABCD. That is lobbying. Okay. Now, if I called them and I said, hey, what I'd like to talk to you about today is home visiting. Now, home visiting may be in Bill ABCD, but I'm not talking about that bill. I'm talking about the issue. Okay. The IRS does have strict rules regarding the percentage of a nonprofit's budget that can go toward lobbying activities. I find the North Carolina Center for Nonprofits to be an excellent resource around this if there's any confusion and you need more information. Asking your member of Congress to vote for or against or amend introduced legislation. Emailing a call to action to your members, not to your friends as an individual, that's different. I'm talking about it organizationally. And preparing materials or ongoing events in support of lobbying activities. Now, I can't see you all, so I'm going to give you my quiz questions though, and hopefully you can kind of like read through them, think in your mind what you think the answer is, and I'm going to give you the correct answer. Okay. What is an example? Which one of these is an example of advocacy? A, calling your lawmaker and telling them about the great work you're doing for families. And this is, think about it as an organization, okay? B, while you're on the phone with a lawmaker, you tell them that you need $100,000 in additional funding. Or C, you're writing language for a bill that includes a funding request. Those are your options. Which one's an example of advocacy? Letter A. So calling the lawmaker and telling them about the great work that you're doing for families. That is advocacy. You're educating them. The others, you're writing a bill, like yeah, that's definitely, you're sitting down, you're working on writing language for legislation. And then the other with having an actual monetary request for funding, that's when it becomes a little bit different. So the following are examples of lobbying, except A, writing a letter to your representative asking them to oppose a bill. B, emailing a call to action to your mailing list asking that they sign on in support of a bill. Or C, providing information on a topic that is part of introduced legislation. So all of these are lobbying except providing information on a topic that is part of introduced legislation. So educating and telling a policymaker about a topic is not lobbying unless you're naming a bill and asking them to vote one way or the other on that bill. All right, let's get into the meat of this, the policies that prevent child abuse. So these are our policy priorities at Prevent Child Abuse North Carolina. There are many policies that we could look at to prevent child abuse. This is not an extensive list by any means, but I share this with you so you can kind of see what we're focusing on right now. Next legislative session will likely have different policy priorities. And there's a lot that goes into the decisions around which policy priorities that we decide to work on for a year or two. So you can see here, one is evidence-based home visiting and parenting education. We have some really strong evidence around home visiting and parenting education and how it can prevent child abuse and really, bolster families, provide them with really good supports and parenting education and home visiting, being those early home visitors going in to support a new family has really positive outcomes, not just around child abuse and neglect, but also around like maternal depression and school readiness, etc. They're really great outcomes. Family-friendly workplace policies. So we're going to talk quite a bit about family-friendly workplace policies. So I'm going to save that one. Family economic supports. I'm going to talk a little bit about that as well. Having access to quality, affordable childcare. The prevention of child sexual abuse. And the implementation of Family First Prevention Services Act. So that's federal legislation that's being implemented here in North Carolina. So hopefully prevent children from going into foster care in situations where parents, if they receive a little bit of extra support, the children can remain in the home. I know the image on the right side is kind of tiny. I don't expect you to read all of that. But these are available on our website. You can download them if you did want to read through all of these policy priorities. So I mentioned earlier that prevention and advocacy, they happen in partnership. And you see here again this technical package in the middle of the page from the CDC. There's also one in there on preventing adverse childhood experiences that also has policy recommendations. You'll see on the left side a really colorful 5 protective factors handout that we have. The top right corner, you'll see home visiting and parenting education system planning that we're involved in with North Carolina Partnership for Children and a lot of other stakeholders as well as they're developing the system so every family would have access to home visiting and parenting education in their community. That's the ultimate goal. So we work with the Smart Start folks and Partnership for Children around that. You see on the bottom right corner, Essentials for Childhood. We have on here Think Babies, which is an alliance of about 25, 30 organizations from across the state that focus on issues and policies around 0 to 3. And then you see there the Early Childhood Action Plan. And I have all of this on here so you can kind of see we went through and looked at the available evidence. We looked at the protective factors. We looked at what's in the Early Childhood Action Plan, Think Babies, etc. When we were thinking through and deciding what policy priorities that we would take a look at and have on our list for this year. So that's kind of where all that decision came from. So I wanted to talk to you just a little bit about story sharing because I think this is really important. When we're talking about advocating for families, I can go down to the legislature or virtually go down to the legislature and talk to lawmakers about, what the evidence shows, what the research says. These are what our policy priorities, which I think is all good and fine. But I also know that sharing your story helps to inspire action through emotion and connection. Lawmakers hearing from you what your personal experience is and connecting it to the policies that you would like for them to support has such a huge impact. And whenever you're sharing your story, it can evoke feelings of urgency, like hurry up, let's do this now. Hope, anger, right? A lot of times, if we're advocating and we're talking about a personal experience we've had, we're mad about it. And that's why we're advocating for a change. Solidarity and self efficacy. So, feeling like, yes, I can do this. And story sharing can really inspire action and overcome emotions that inhibit action. So, I wanted to share that with you all because it is so important. If you're comfortable with it, sharing the story behind why you're making that call or visiting with that lawmaker. So I wanted to give you an example of different messaging because sometimes it can feel a little bit overwhelming to try and think about contacting a legislator and talking to them about whatever issue it is you want to talk to them about. So this is kind of the way we break it down. We start with a value message. All children deserve to grow up in a safe, stable, and nurturing home. That's like our top line message for everything we do. We have a problem message. So at some point, everyone will need to take time off to care for themselves or for someone else, like a newborn baby, a personal illness, or caring for aging parents are examples. Families are forced to choose between earning a paycheck to meet their basic needs and caring for themselves or a loved one. Stress is a risk factor for abuse, and poverty is a risk factor for neglect. So your solution message is paid family and medical leave provides economic relief during stressful times. And a comprehensive paid family and medical leave policy is an investment in families and in our future. And you could tailor that for local, state, or national policy. But I wanted to give you this example so you can kind of see how it breaks down that, we start with our values, we go to the problem message, and it doesn't necessarily have to go in this exact order. But I think it's helpful if you're trying to figure out what you want to say, and then your solution, and then your action. And where can you share your personal story? Wherever you want. You can lead in with your personal story. You can talk about it as part of your problem message. You can talk about it as part of your solution or action if you want. You can share your story at any part of this. So I encourage you, if you do have a story to share around paid leave, okay, we do have a paid leave portal where you can share your individual story with our partners at Moms Rising. They are experts at this. They take stories that are shared with them and deliver them to legislators. They can also help prepare you to share your story if you wanted some coaching and some feedback. If you wanted that, they can do that. I can do that as well. But I wanted to share this link with you so you can kind of read through this. And the type of paid leave and paid sick days that we're advocating for are not just for new families, like with a newborn. It would be for families who need to take some time off because a foster child has just come into your home and you need to take some time off for that adjustment period. It's not just for newborns, and it's also if you needed to take time off to care for aging parents, for example. So it would be inclusive. And I'm going to tell you a little bit more about that specific policy. So first, I want to start with the Pregnant Workers Fairness Act. This is an example of a family-friendly workplace policy. And right now, we don't have a Pregnant Worker Fairness Act here in North Carolina. We're looking at this on the federal level. And really, this is about being able to provide reasonable accommodations. And you can see here what the definition of reasonable accommodations is. So it could be like being able to have a water bottle, having a stool to sit down if you're standing for long periods of time, having breaks. It's really about ensuring that pregnant people are able to have whatever reasonable accommodation they need to lead to positive outcomes in their pregnancy. So, lots of good research around this. It improves maternal and child health, as you can imagine, reduces infant mortality, and reduces doctor and hospital visits. So, when children have good health in utero and good birth outcomes, they are more likely to have good physical health and on track development during childhood and throughout life. Discrimination against pregnant women is far too common, especially among low income workers and women of color. And the pandemic has only increased the need for clarity regarding employers' obligations to provide these accommodations for pregnant workers. There is legislation on the federal level. It has passed the House, the United States House of Representatives. They just had a vote on it a little over a week ago, and it has passed. So it is going to the Senate now, and hopefully will pass the Senate. And if it does, hopefully it will be signed into law. The recovery rebate for working families. This is an economic support for families and a concrete support for families. So how does this EITC prevent child maltreatment? And you may have heard of an EITC, an earned income tax credit. We still have a federal earned income tax credit in North Carolina, but we know it's been, I don't know, about 10 years almost now that we haven't had a state EITC. So it's an economic support tool and strategic policy designed to help low-income families meet basic needs. So there's some really interesting research out there for places that have an earned income tax credit. So it's associated with reductions in CPS involvement. And it's been associated with an 11% decrease in foster care entries compared to states that don't have that state level EITC. So what that would mean would look like 1,150 fewer children or 60 full elementary classrooms full of children could be diverted from entering foster care each year. So it might be something that you don't really think about, an earned income tax credit and what it can do for families. And usually it's around $500. in North Carolina is what it has been in the past. So it's not a huge amount, but it makes a huge difference for families. So something to consider. Paid family and medical leave. So when we're thinking about paid leave, I kind of mentioned this to you earlier. We're talking about legislation that will provide every person with access to paid family and medical leave. And we're looking at it through a couple of different avenues on the federal level. There was a bill introduced here in North Carolina around paid family and medical leave in both the House and the Senate. Unfortunately, we didn't see movement on either side, but there is a lot of work happening on the federal level, and there have been several different proposals. There's been a bill, there's been recommendations out of the Biden administration, there have been recommendations out of committee. There's just been a lot happening. We're looking at an insurance pool here in North Carolina where everyone would pay a very minimal amount. I think it's a few dollars a week to pay into this insurance pool so everyone would have access to this paid family and medical leave. So, how does it prevent child maltreatment? A few different ways. There was a study that was conducted by the Duke Center for Child and Family Policy just a couple of years ago, and what they found that if we had in North Carolina a paid leave model that provided paid leave for 12 weeks and 80% wage replacement, it could save 26 infant lives in North Carolina. And we have a pretty, unfortunately, it has decreased some, but the infant mortality rate is still pretty high here in North Carolina. So if we had something like this, it could save the lives of infants. And then also on top of that, it's the communities and states that have paid family and medical leave. They've been able to show that having access to that has also reduced abusive head trauma in infants, which that includes shaken baby syndrome. And abusive head trauma is the leading cause of physical child abuse deaths in children under the age of 5 in the United States. Babies less than 1 year old are at greatest risk of abusive head trauma, and abusive head trauma accounts for about 1/3 of all child maltreatment deaths. So, it make a huge difference here in North Carolina having this. Safe Days in Kin Care. This was a piece of legislation that we did work on here for this session. And there was a bill introduced, and unfortunately, it didn't have any movement. But I do think that this is an important piece of legislation because it's something that right now we don't have protections for here in North Carolina. So basically, what this says under Safe Days in Kin Care. So with kin care, it explicitly says that whatever kind of sick leave an employee earns, it can be used to care for a family member. And the definition of family member is pretty broad. Right now in North Carolina, many of our individual employers allow us to take sick days to care for our children or another family member if needed. But there are employers that don't allow that, and that they only allow you to take sick time to care for yourself. So that is what the kin care part is. Safe Days explicitly says that whatever kind of sick leave an employee earns, it can be used to deal with the physical, emotional, or legal impacts of domestic violence, sexual assault, or stalking to seek safety. So this bill is not requiring sick leave, although that would be nice if everyone had access to paid sick leave in North Carolina. This is, though, saying whatever sick leave you earn, whether it's paid or unpaid, that you can take that time to seek safety or to take care of a loved one who is sick. So, why is this important for preventing child abuse? When domestic violence is present, children are at an increased risk of physical abuse, neglect, and child sexual abuse. Keeps us healthier, keeps people in their jobs. That's economic security. Reduces turnover, boosts business productivity. A lot of benefits to having the safe days in kin care. And in many states, this has been uh, a bipartisan issue and championed by a lot of different leaders across the country. And unfortunately, it's not something that we have here in North Carolina. So I wanted to share with you all a few next steps that you could take after our time together today. So, one is you can sign up for our policy alerts and go to the website. And I will go back to that slide here in just a minute so you can see that again. Go and sign up for our policy action alerts. And I don't send out too many of them, but when I do, take action. You just click on a button, and usually we have an email that's already pre written that you can send out to your elected officials. You can usually edit them and add more information if you have more you want to uh, add to it. Sign up for those, send those out. I would also ask you to contact your congressional delegation about paid leave. So that's going to be your senators, folks from your House of Representatives, and tell them that you think we should have paid leave. I can help you with talking points. If you need some help with that, I'm happy to do that. I'm happy to have individual conversations with you all if you kind of want to know what's happening in the paid leave space. But contact them and let them know why. Why do you think paid leave is important for families? You can contact Senators Tillis and Burr about the Pregnant Workers Fairness Act. That's the one that I mentioned that had a vote just over a week ago in the House. So it will be moving to the Senate. You can contact them. You can call them. You can email them. And also, if you go on to our Policy Action Center page, you can look up who your representatives are. So if you're not sure, I'm not sure who my person is, I don't know who I need to reach out to, that's okay. There's a way that you go in there and you have to put your address in there because it's based on what your address is. But it'll give you their email address and their phone number, all of that, so you can easily contact them either way, whichever way you're more comfortable with contacting them. You can contact your state legislators and tell them that you support the state using ARP, which is the American Rescue Plan funds, for a refundable state earned income tax credit. That's also referred to as the recovery rebate. So we had this big recovery bill that passed on the federal level. We've had several of them pass. One of them was the American Rescue Plan. Those dollars, half of them now are in the state of North Carolina waiting to be appropriated out. And that money, some of that could be used for us to restate the state earned income tax credit. It has been approved for that. So contact your state legislators and let them know that you think that we need a state earned income tax credit. And that's one way that they could spend some of that money. You can co-author an op-ed with us if you'd like, or if you'd like to submit one on your own. I'm happy to help you out with writing that. However I can support you, I'm happy to do that. We just had one run this week in the paper, in the News and Observer, on the recovery rebate on the earned income tax credit. And getting those op-eds and those letters to the editor out, very important way for us to be able to get information out. Legislators do read those. You can write a letter to the editor sharing your personal experience, your personal opinion if you want, or an op-ed, either way. It's a great way to share information. And then share your stories. Do you or someone you know have a story to tell? What would paid leave mean for your family? How have you seen home visiting change lives, etc.? And I'm giving you all examples that are related to our policy priorities. I encourage you to do this for any issue that you care deeply about. Reaching out to your legislators and letting them know this is what you would like to see happen, and this is why you would like to see that happen. So, a closing remark I want to leave you with, and then I'm going to go back to the slide so you can see again what you need to do to enter the contest. But I thought this was a really great quote when we're thinking about child abuse. I don't know anyone, not one single person, who isn't in favor of preventing child abuse. It's one of the few remaining topics in our society that tends to halt partisanship and the attack mode associated with our political dialogue these days. And that's from our friend Jean Bolduc, and it was an op-ed that was in the Herald Sign. It's an issue that we all care about. We all want children to be safe, and we all want them in nurturing homes. Um, that is a universal topic, I do believe. So let me back up to the slide where it has the information about, sorry if this is like making you dizzy. I'm not trying to make you dizzy. Let me escape. That'll make it easier. I want to go back just to show you again, so you can see my email address. Please sign up for our action alerts. The first 5 who send me a confirmation signing up, I will be awarding you a free membership to our Prevention Action Network. M. Rose Waters at Prevent Child Abuse North Carolina is my email address. Forward to me the confirmation, and that way I can let you know who the top 5, the first 5 were that sent that in to me. And with that, I will share with you if there's anything different on here. Nope, there's not. There's my email address again. I will stop sharing now in case anybody has any questions, so I can't see the participants, but I can.
Thank you
Yes.
so much. That was wonderful. So if anyone does have any comments or discussion, go ahead and put it in the chat, and then I can bring those to Malia. One thing I did have a question about is I know a lot of our families have questions about the Families First Act and having a lot of kind of specific guidance about what that's going to look like and what that's going to mean for them, and any information you can provide, particularly about kind of the prevention piece, because I know that's such a huge part of it. And what maybe that will kind of look like in practice and some of the implications for foster parents specifically.
I will say that our president and CEO at Prevent Child Abuse, Sharon Hirsch, she is part of the, I don't know if they're called an advisory group. I'm going to call them an advisory group that is really thinking through what and making the decisions about what Family First is going to look like here in North Carolina. I believe that they're planning to start the rollout of that. They have to, I think, in the fall of this year. They have, I believe, gone through and selected what programs North Carolina will implement. So there's an entire list of programs that the federal folks have said, these are ones that we approve of, that you can use this money for. And so they had to go through and look at those and say, okay, these are the ones that we have here in North Carolina and the ones that we will support in North Carolina. Now, as far as how it's going to look in implementation, I don't know exactly I don't even know if they've figured out exactly what it's going to look like as it's implemented. Yeah. I know the intention is that, for families who just need extra support around substance misuse, to be able to provide in-home services. Now, that is not to keep children who are in dangerous situations in the home, of course, right? There's a ton of research out there that shows that if we can keep children at home with their family of origin, it's better for them. But it's not better if they're in a dangerous situation. You all know that. So I think the intent is to be able to keep kids at home who can stay at home, and the parents get the treatment that they need. I imagine that there will be, markers in progress that will have to be followed and say, oh, you have to do this by this time. I'm just guessing. I'm assuming that's how it's going to be implemented. I don't remember off the top of my head which programs they've selected in North Carolina. Um, and I'm not sure if they released that information. I don't think it's top secret, but I just don't remember off the top of my head what they are. But there are several that they will be using for this home visiting model. So we'll likely see fewer children coming into foster care. That's the ultimate goal with this. So it's not necessarily primary prevention. This is not necessarily going to be children, this is going to be people who have come in contact, right, with child welfare, and need some additional supports. So hopefully we will see some recovery for families, and children will be able to stay in their homes with their birth families.
Yeah.
We'll see we'll see. We'll know in a couple of years, right?
Right, like any policy, typically,
Yeah.
are not really sure. So we do
Yeah.
have a comment from someone said, my husband's work won't give him leave unless we adopt a foster child within a year of placement. I wrote them a letter to explain that foster care adoptions take a lot longer than a year due to the hope that reunification will take place and other points that I shared. They give 8 weeks paid time if you adopt a newborn, but nothing realistic for foster care.
Oh, that is disappointing. That is disappointing.
Yeah.
And I'm glad that you wrote a letter. That's good. And I encourage you to continue speaking up and saying, this needs to be a more inclusive policy. Families look different. They're not all exactly the same. They don't come together exactly in the same way, and that's okay. So we need to be inclusive of that. And yeah, absolutely. I'm sorry. I hate that for you. I really do. I do feel like the proposals that have been put together on the federal level are more inclusive. And I think they include like foster families and but I continue to continue. I encourage you to continue on. One of our partners at Family Forward NC, they do a lot of work around sharing sample policies for businesses to be able to implement around paid leave, around safe days and kin care. Like they have on their website, it's Family Forward NC, examples of policies. And they may have something on there with language for you that you could propose to them and say, here's actually some language that you could add into your policy. I'm not sure off the top of my head, but they are an excellent resource if you're looking at wanting to change business policy like within an organization.
Thank you for that. I just put the link to just the Family Forward NC in the chat. So, but thank you. We didn't know about that resource. Other comments or questions? Sometimes it takes people a minute to type too, so I want to be mindful of that.
And I wish that I could see you all. So
this is the one downside of this platform.
I do wish I could see you. But you have my email address. And if you do think of something later on, please reach out to me. I hope that in seeing these policies that, maybe you'd never thought about paid leave as a way to prevent child abuse. Or maybe you'd never considered, having an earned income tax credit or refundable, getting your taxes back, right? As a way to prevent child abuse. So I hope that I've been able to connect some dots for you all today to just kind of think about it in a different way. And we do have one-pagers on a lot of these. If you wanted more information, I'm happy to provide that for you as well.
Well, and something I love, Malia, that you're talking about is a lot of this prevention is like self-care for families, right? For parents themselves. It's not even necessarily child focused, but it trickles down and has that positive effect on the child. And I think, in this particularly with kids who've experienced trauma and have gone through so much, it's hard to remember to back up and say, I need to do these things for myself in order to be able to care for this child. And so I just love that you focus so much on something like family leave, which is critical and is really almost a form of self-care. So thank you for that.
Oh, thank you. And it's true. And if parents or caregivers, when parents and caregivers thrive, when we as grown-ups, when we thrive, The children that are in our care thrive. When we are taking good care of ourselves, when we have economic stability, which a lot of these policies help bolster, um, reduces stress, reduces that likelihood with all of the things that are compounding. It's not just one thing. It's the economic stress, and then it's I can't take time off, and I need to care for my parents, and I have a young child I need to care for. All of these things are compounded. It's not just one.
Yeah.
And I think probably we know, I trust that this audience knows this, that it's very expensive to be poor. It's very, very expensive to not be able to meet your basic needs. It costs a lot. What I mean by that is one late payment can have a domino effect, right? So it's yeah, I appreciate you saying that. We do have to care for the adults so the adults can care for the children.
Absolutely. Well, and one last comment. I find it sad that there has to be a policy for pregnant women at work. It should be a natural action to take care of pregnant women. And again, absolutely, like in principle, these things are just so obvious and should be in place. And I think it speaks to the importance of advocacy and lobbying and, all of these actions because we really have to push for some of these things that really should just be naturally in place or natural rights for people. So
Yeah, you think about with the pregnant worker accommodations. I think many, many, many employers, allow you know water, bathroom breaks, all of that, right? I don't. I think it's the majority of employers that probably offer something like that. But when you start thinking about like if a person who's pregnant is working at a job that requires a lot of physical lifting, for example, right? Which once you're 7, 8, 9 months pregnant, it makes it very difficult. But it's also not healthy for someone to be lifting heavy things, right? So it's also about that, like making those reasonable accommodations. Um, and we just don't have that here in North Carolina. It's not required, but it looks like we may have something on the federal level. So that is your chance to advocate right there.
great. All your senators. Yes.
It passed with overwhelming support in the House. So we do hope that we will see the same happen in the Senate, but you never know. So it's always good to bring it up to the senators, to send them a quick note saying, hey, I support the Pregnant Worker Fairness Act. Like, this is no brainer. We need to do this.
Right.
So
Well, thank you so much again. This was such a wonderful presentation. It is all recorded, and
okay.
so we will also be sharing this with everyone. So and I put lots of links in the chats, but if anybody wasn't able to be here or get those, it will be available. So thank you so much. We
Thank
appreciate you
you.
being here.
Thank you. Thank you all so much. Have a great rest of your day.
You too. Thank you so much.